In Sweden, the authorities' strategy to fight the virus has come under increased scrutiny. The Nordic country has stayed away from quarantine and lockdown measures and instead urged the public to act responsibly. But the number of deaths continues to climb, especially among the elderly. Our reporter Per Bergfors Nyberg reports.
This is Moses Ntanda celebrating his 70th birthday at a restaurant in Stockholm 2 years ago. Last month during Easter, he died alone in his nursing home room from COVID-19.
Moses was my uncle and he was like a father to me.
When Moses was diagnosed with COVID-19, Juliana and her husband begged the local authority and the staff at the care home to take him to hospital.
They said that that's not how they handle it when the old people get corona. They take care of them in the home instead of sending them to the hospital, and that he's not in need of hospital care. But the truth was he actually was in need of hospital care.
One day at work, everybody was starting to scream like, "Hey, Peter, you need to come, something has happened to your mother-in-law's brother." So I ran to her and she fell down on the floor, so I hugged her and we cried.
Almost half of Sweden's coronavirus deaths are elderly people who were living in nursing homes. Swedish authorities admit that imposing a ban on visits was not enough to protect the elderly.
There's a lot of different aspects to our approach. Protecting the elderly and the elderly homes was just one of them. That approach did not work very well. We are all aware of that. We are not trying to improve that approach as much as possible in collaboration with the people running and are responsible for these homes.
Sweden's coronavirus strategy is about recommending social distancing rather than ordering a complete lockdown. Now, some medical experts here claim, though, that has been a dangerous strategy.
We have one of the highest death rates in the world, which is sad. I would say that 2/3 or something like that, maybe even more, wouldn't have to have died.
So far we have managed with one of our goals, and that is to flatten the curve of the virus spread and also making it possible for the healthcare system to cope in this very strong challenge. But for every person who has died of this terrible pandemic, it's of course of a great sorrow and pain for all the families. And we will of course try to see why did the virus spread in the elderly care.
They think that the strategy that they're using is really good and that it's working. But if it's good, how come so many are dying?